Tonight, Franklin County and many surrounding areas are in the green. And while the community spread of COVID-19 is low, we are approaching flu season. Thanks for staying with us at 5:30, everybody. I'm Yolanda Harris.
And I'm Andrew Kinsey. Let's take a look at the newest COVID-19 case data from the state. Tonight, the Department of Health saying that Ohio is breaking a 10-week trend and COVID-19 cases are going down. The Department of Health reporting more than 14,000 cases in the last 7 days. Last week, we hit more than 20,000 cases. Hospitalizations look like this. They're also trending downward. This week, the state reported 523 people were sent to the hospital from the virus. That's down from last week, where there were 600 people sent.
Well, joining us tonight is Dr. Joseph Gastaldo, an infectious disease specialist with OhioHealth and a member of the 10 TV team of experts. Haven't seen you in a while, but good to see you as always, Dr. G.
Yolanda and Andrew, thanks for having me. It's good to see you.
All right. Well, Dr. G, COVID numbers and hospitalization numbers are down here in Ohio. And as we head into the fall and the winter months, do you think the numbers may start to go up again because more people will be indoors with colder weather?
Yeah, that's obviously always a possibility. You know, nationally, we're still averaging above 400 deaths a day from COVID, and in Ohio, anywhere from 12 to 14 deaths a day. So I think we are still living with this virus. The pandemic is still going on. I think COVID is less disruptive. We're in a much different place today than when this virus first came on the scene. And like you said, as more people gather indoors where there's less proper ventilation of air, like influenza and other respiratory viruses, we will likely see more COVID.
Yeah, Dr. G, you know, President Biden making headlines this week with a slip up in some verbiage that he used. Take a listen.
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
All right, Dr. G, what do you think about the president's comment there? Is the pandemic over, or are we still in it?
Yeah, we are still in the pandemic. You know, I think the emergency phase of the pandemic is over. This virus is less disruptive. We have vaccines, we have treatments, we have better availability of high quality masks. And, you know, for people who are vulnerable, for people with weakened immune systems, the pandemic is still going on.
Well, you know, Halloween is coming up next month, and of course, the kids are excited about that. Do you have any concerns about COVID spread during, you know, Beggars Night or Halloween parties, things like that?
Well, that hasn't been the case yet. You know, outdoors is very, very safe compared to indoors, and we really need to get children back to being kids. And I think outdoors Halloween, that is a safe environment. I think it's different if you're talking about potentially where there is somebody who is sick and not feeling well. And part of the message moving forward, too, is, you know, have a plan in place. If you're not feeling well, how do you get tested? And if you have an at-risk condition, how do you get outpatient treatments?
All right, Dr. G, this is something many doctors are talking about, flu season, looking ahead to that and pushing for vaccines and vaccinations for that. If you're all vaccinated and boosted up for COVID, do you still need to get that flu shot? And what if some folks are like, hey, I don't want another vaccine in my body right now?
Yeah, so that's a great point. You know, the canary in the coal mine for our flu season is always what we see every year. Southern Hemisphere, Australia and New Zealand. They're coming off of a rough flu season, and when we've seen that before in the past, we typically get hit harder with flu. The flu vaccine is FDA approved. It's recommended for anybody 6 months and older. You know, I've gotten a flu shot every year in my life since being a kid, and it's something that really keeps people out of the hospital, like the COVID-19 vaccine, and prevents people from dying from flu.
All right. Well, Dr. Joseph Gastaldo, it's so good that you spent some time with us today, clearing up some things. We also definitely want to hear your expert advice on all of this stuff. So thank you for joining us again.